you happy to introduce things tonight, because you probably know the topic?
So people are coming in actually. And let's just give it a minute or two. So let's get started. And, it's going to be an interactive session between me and Grace. And Grace, do you want to say a few words about yourself, where you work at?
Yes, my name is Grace. I'm a second-year resident doctor in Northern Ireland, outside Belfast, and I'm currently working in intensive care. I finished medical school just 2 years ago, so we've been working together for the last year and a bit, doing different things with ICU Reach.
Perfect. And that's why we're having the session today, where we're going to be learning about pressure-regulated volume control mode of ventilation, or PRVC. And if you missed any of the previous sessions, they are all recorded and available on our ICU Reach website, www.icureach.com, and also available on our YouTube channel for free. So the way we're going to have it today, let me just share my screen first. And do you see the ventilator? Yes.
Yeah. It's the ventilator.
Okay. So in the previous sessions, we talked about volume control mode of ventilation and pressure control mode of ventilation. And we've seen how changing resistance or compliance is going to affect the waves. But let's just review that once more. And as you see here, I'm just going to change to CMV. And as I indicated before, this name is German name, but essentially it's CMV, which is control mode of ventilation. And you can see here that the patient is on tidal volume of 500, meaning that the target is 500. The machine is going to deliver 500, regardless of how much pressure it's going to use. However, we have a limit, and you can see the red line here, which is the limit, meaning that the pressure cannot go above 50 centimeters of water. And as you see here, to deliver the 500, we're utilizing a pressure that goes up to the peak pressure of around 14 centimeters of water. And then we have a plateau phase, meaning that the air goes into the lungs and we hold it for like 0.5 seconds. And the reason why we have a plateau phase here is because we have an inspiratory time of 1.5 seconds. And we need to get in 500. We have a flow rate of 30 liters per minute. And that will take us 1 second. So the remaining time will be a plateau time or a pause. And in order to keep the air inside the lungs, we need the pressure, and the pressure is required to overcome the lung elastance. Now, what we're going to do is we're going to increase the resistance here. And Grace, tell me what will happen to the next breath.
So if you increase the resistance, you'll need more pressure to deliver the same volume into the lungs. So the pressure curve should go higher. So
let's see it. So I increase the resistance here, and you can see the volume remained the same. The pressure increased because the target is the volume of 500. So the machine will utilize as much pressure as needed to deliver that volume. And you can see that the flow remained the same, meaning that the flow goes up to 30 liters per minute, stays at 30 liters per minute, and then goes down after the 500 is already in. Okay, so even if we just release the resistance or improve the resistance, so go back, pressure goes down, volume remains the same. Even if it is compliance, let's just decrease the compliance here. It's going to be the second breath and the third breath. And it's the same thing. You can see that in order to get the volume in, we require higher pressure. So let's see how high the pressure would go. Let's decrease the compliance to the minimum. Let's increase the resistance. So as you see here, we touch on the limit. And the pressure cannot go higher than the limit that we have. And you can see we're not able to deliver the tidal volume because of the limitation on the pressure. So this is very simple and clear. Is that correct, Grace?
Yeah.
Okay, so let's just see how things are with pressure control mode of ventilation. So I'm going to go up on the compliance again back to normal, and I'm going to decrease the resistance back to normal. And I'm going to change the mode to a pressure control mode of ventilation, and I will use a pressure of 12. So we have here now, it's called BiPAP, but it is pressure control mode of ventilation. You see how the flow waveform changed from square to decelerating. And we're with this 12 centimeter of water, we're delivering about 500, 530, 540. So now, Grace, if I increase the resistance here, what would happen next?
If you increase the resistance,
and this is pressure control, meaning that we're controlling pressure at 12 centimeter of water.
you have to increase the flow.
If the resistance increased here, and this is by the patient out here, so I'm not touching the ventilator. If the patient developed increased resistance. So let me ask a question. What's the target in this mode?
The target is the pressure. You're keeping the pressure the same, so it's going to be volume.
Okay. How does the machine deliver the breath with this? The flow now cannot be controlled anymore. Take a look on the settings. There is no flow. Okay. All what I can control is the pressure. So here the control is 12 centimeter of water. And you can see that the pressure goes up to 12 centimeter of water and stays at that level. Now, with this resistance and compliance of the respiratory system, we're able to get 500 in. Now, let me just do it for you and explain it. I'm going to increase the resistance here. So resistance increased. I'm going to freeze it. So what happened next?
So the volume curve is decreased.
Excellent. Why? Because with this much pressure and the high resistance, we're not going to be able to deliver the 500.
Yeah.
We're able to deliver only 300. Okay. And this is actually, if you go back to the equation of motion, the pressure on the left side equals resistance multiplied by the flow plus volume divided by compliance. And compliance is the reverse of resistance. I'm sorry, reverse of elastance. So as you see here in traditional mode of ventilation, if you have someone on pressure control mode of ventilation, any increase in the resistance or decrease in the compliance, the machine will deliver the same volume, the same pressure. However, because of the increased resistance, the volume will be less. And this is what resistance, same thing with the compliance. They just go back. I'm going to decrease the resistance. So this is back to the baseline. Pressure of 12 is actually delivering around 540. Now let's go down on the, I will wait for the next breath. Okay, we go down on the compliance. We can see here, the next breath is same pressure, no change. However, volume is much less. The flow is much less. The same pressure is not going to be able to push too much flow because of the increased elastance. All right. So this is how volume control mode of ventilation will respond to increased resistance or decreased compliance versus pressure control mode of ventilation in relation to changing respiratory dynamics. So now I'm going to go back. Let me just get this back to normal first. I'm going to go back to volume control mode of ventilation. And again, in volume mode of ventilation, let me just freeze it for you here. And you can see the difference between the flow in pressure control mode of ventilation is decelerating, and volume control mode of ventilation is square. Okay. So I'm going to unfreeze and move from this to pressure regulated volume control mode of ventilation. So what we're going to be doing is we're going to regulate the pressure. And in order to do this, there's different name of this mode depending on the ventilator that you're using. The PRVC trade name is actually coming from Servo U or Servo I. It's called pressure regulated volume control. On the dragger, it is called autoflow. And you just turn it, meaning that you're going to automate the flow. On Bennett, or Puritan Bennett, which is Covidian company, Medtronic, it is VC plus. So depending on which ventilator you have, it may have a different name. On the G5 or the Hamilton, it is APV, adaptive pressure ventilation. So it will be ABV CMV or ABV SIMV. Okay. So on this ventilator, which is dragger, it is autoflow. And this can be done in any volume control mode of ventilation. And that's why I'm starting here from volume control. And you can see that I'm controlling the volume of 500. The flow is square wave. The pressure goes up gradually to deliver that volume. So what I'm going to do now, I'm going to change from volume control to PRVC. And as I said, it is called auto flow. And you can see with additional settings, you turn the auto flow on and see what happens. I'm going to freeze it. And then I'm going to ask you, Grace, to describe what you see. So this is where I turned the auto flow on. Just tell me what happened to the pressure, what happened to the flow, and what happened to the volume. And put in mind, this is intermediary. So this is in between the two. This is volume control, and this is when we turn the PRVC. So compare this one with this one. Start with the pressure. What happened to the pressure?
So the pressure went up more slowly and gradually. And the maximal peak of the pressure wasn't reached in the middle of the breath. It was reached by the end of the plateau phase of the breath.
Are you talking about the middle one here?
Yeah, I'm talking about the middle one, yeah.
Yeah, can you ignore the middle one? Just compare, because this is transition from this to this.
Yeah.
So let's just compare this one with this one.
Okay. So again, the first compared to the third, it reaches the maximal pressure more quickly, and it stays at that level, and it's a lower pressure overall than the first one.
So excellent. So let's just say, so it is constant pressure. It goes to a certain value and remains at this value. Compared to the first one, it's increasing pressure. It goes to the peak pressure here, and then we have a plateau. We don't have a plateau here. So it is constant pressure. What about the flow?
So the flow, rather than the flow staying at the same level, the flow begins to decrease quickly after its peak.
Okay, so this is a square wave. Here it's decelerating flow wave. So you can see that the flow goes up to a certain value here. We don't see this anymore. The flow now goes up to maximum value and then start decelerating. And by the way, all what I did is I turned the auto flow on. I did not change any settings. Now you can see that the tidal volume is the target. So I'm still trying to deliver 500 ml. What happened to the volume?
So the overall volume, it looks like a smaller area under the curve, but it probably is the same if you're aiming for 500 for both.
Correct. And you can see it here. Now,
yeah.
This is frozen now, but in the background, we're still seeing that every time we're delivering 500, which is the target.
The target, yeah.
So now if I open the settings for you, see with this mode, we're setting the tidal volume. We cycle from inspiration to expiration after 1.5 seconds. Of course, the rate 12, meaning that the trigger is every 5 seconds. And we have a ramp here that is 0.2. We did not have this in the previous. Let me just go back a bit and turn it off so you can see the controls before we turned this on. Okay. So let me. Okay. So you can see here, before we turn the auto mode, the auto flow on, we had tidal volume and we had a flow. And we were controlling the flow at 30 liters per minute. That's why we see the square wave. Okay. The cycling or inspiratory time is the same. Rate of 12, peak of 5. We do not have a ramp here. Now, all what I'm going to do is I'm going to turn the auto flow on, and you can see how by doing this, how we change the controls that we have. We're not able to control the volume, the flow anymore. We have a tidal volume, which is the same. But from the name of it, it's auto flow, meaning that the flow is going to be automated. So that's why we're not able to control the flow anymore. But you can see we added here a ramp, which is how quickly the pressure is going to go up. This is the initial rise in the pressure. So going back to what we have already discussed, the pressure, instead of varying pressure, it is constant pressure. The flow, instead of square wave, it is decelerating wave. The volume is the same, which is the target. However, you can see how the shape of the rise in this volume is changed. You can see it's going up here with a straight line. Why? Because we have a fixed flow. However, here we see this, is it concave or convex? You know English better than me.
Yes.
So you can see how it is. Yeah. So it goes up very faster initially. Why? Because we have a higher flow. And then the flow starts to go down. That's why the rise is actually slow So I'm going to unfreeze now, and this is where we have the auto flow on, decelerating flow waveform. The target is 500. So if you did not see the name of this, what you would say is that this is exactly pressure control mode of ventilation. This is how we started when we looked at the pressure control mode of ventilation. Because the pressure is constant, flow is decelerating. However, what you see here on the setting that we are controlling the volume. So you should know that probably this is a volume control, but the pressure is regulated. So now let me ask you, what will happen? So to understand what pressure regulation means, of course, we're not going to benefit from it if it is pressure control. It has to be having some advantages. So I'm going to increase the resistance here. So tell me what would happen before I do it. If I increased the resistance here, what will happen in the next breath?
The pressure.
So you think the pressure is going to go up?
Well, if the volume still remains controlled, then yes.
Okay, excellent. So let's stick to what you said. I'm going to wait for the first one, and then I'm going to increase the resistance. Okay, so here the resistance is increased. I'm going to freeze it for you. Okay, so you said that the pressure will go up because we are controlling the volume, right? And the volume will be 500. What do you see here? How much pressure? Did it go up?
Not in the second pressure, but in
okay,
the
excellent. Yes. So not on the second one. Okay, how much volume did the machine deliver? Take a look on it. It's probably around 300, 350, right?
Yeah.
Okay. So despite the fact that we have a volume control, when the resistance increased here, the pressure did not go up. But as you mentioned, what happened next? Tell me.
The pressure increased.
The pressure increased slightly, and the volume is increasing slightly. So the way it works that the machine gets feedback. So it is a closed loop ventilation. So when the resistance increased here, the machine did not know that yet. So it delivered the next breath with the same pressure that used in the previous breath, because it was thinking that this pressure would deliver the same tidal volume. But in fact, it did not. Now the machine knows that, well, there's a problem. It could be increased resistance or decreased compliance, because the pressure that the machine used did not deliver the 500. So at that time, the machine knows that we need to go up on the pressure. But the machine will not go up in the pressure suddenly to deliver that 500. It will regulate the pressure gradually. And every time it will go up 2 to 3 centimeters of water and see what is the volume that is delivered, get more information, and then readjust the pressure if needed. So I'm going to go back. And this actually goes along with the so with the increased resistance, pressure on the left side equals resistance multiplied by flow plus volume divided by compliance. So with the increased resistance, what we see here, that the same pressure is delivering less volume. So I'm going to do it again. So this is back to, I just went back on the resistance to normal. And I'm going to do it again so you can see how the pressure is gradually increasing. So this is the first one, and then I'll go up on the resistance. Okay, take a look here, same pressure, delivered less volume. So the pressure increased, we have 390 now. We need higher pressure. The pressure went up, we have 486. The pressure needed to go up higher to be able to get 500, a bit more. Now we're at 500. So you can see how the pressure is gradually increased. And that's what we mean by pressure regulation. Instead of the pressure goes up to deliver the target tidal volume, the pressure will gradually go up for that target tidal volume. So is this clear, Grace? Okay. So now let's just see, what if the problem is severe? Remember that red line over there where we said the pressure won't exceed that line. And remember when I increased the resistance and decreased compliance, we touched on that red line. So let's just do the same thing here. I'm going to go down on the compliance. Actually, that's why. Okay. So as you see, we're not able to deliver the volume. So what's happening to the pressure? Gradually increasing. So you can see that. I'm going to go down further and go up on the resistance. So you can see how the pressure is gradually increasing. So we're up to 35. We're still not able to deliver the volume, and the pressure will continue to increase. Of course, it's going to give you an alarm, a warning that minute ventilation is low. Okay. So we reach, is it 45 now? We'll just see data. Yeah, 45. So you can see here that we reached 45. We did not touch on the red line. Is the pressure going up any higher than this?
No.
Did we deliver the volume?
No.
Okay. And why is that? Well, and I don't know why they do it this way, but the limit is actually 5 centimeters below the red line. So in pressure control mode of ventilation, you touch on that red line. And in the same ventilator, it's 5 centimeters below the limit. Control is the volume. However, because of the limitation in the pressure, we're not able to deliver the tidal volume. Okay, so that's the second point, is that the limit is, of course, you're not going to let the pressure go up to 45. This is, if the patient has ARDS, you don't want the pressure to go to that level. I'm just doing this for the demonstration. In reality, you should set that red line, which is actually, you can adjust it. If I do that, take a look here. This is where the red line is, the alarm limit. So if I want to do it more realistic, I should actually do it at 37. And if I do it at 37, look at this. The pressure is going to be 5 centimeters below that 37. And of course, we're not going to be able to deliver the tidal volume here. Let's just improve that compliance a little bit so you can have a better graph. Okay. I'm going to repeat this because I need to see the reverse now. I'm just going to go back to normal. This is 6 and this is 100. And again, it's something for the audience. If you have any question, you can raise your hand and I'll give you the mic, or you can put it in the chat or the Q&A section. So let's wait till we go back to 500. It will take some time actually because it was too high pressure. We're approaching the 500. I think the next one is going to be with 500. Okay, excellent. So I'm going to do this again. I'm going to increase the resistance here, and you'll see the same thing happening again. So, not this one. Okay. So now, increased resistance, you can see that the pressure is the same. The volume is less. So the pressure will go up 2 to 3 centimeters of water each breath. Volume still low, will go up higher. The next one is going to be with a higher pressure. You can see the volume is approaching 500. And the machine will keep that pressure because this is the pressure that is delivering the I'm going to improve the resistance here. Go back to normal. Tell me what will happen in the next breath. What will happen to the pressure and what will happen to the volume.
So if you reduce the resistance, the pressure will fall and the volume will increase.
Okay. Why the pressure is going to fall?
Because less pressure is required to overcome the resistance to deliver the volume.
Okay, but the machine doesn't know that yet. It does not know that the resistance is improved.
So initially the pressure will stay the same.
Excellent.
And then the volume will go up. So it'll not be till the next breath it will decrease.
Perfect. And this is exactly how it functions. So I'm going to improve the resistance here. The machine doesn't know that the resistance is improved. The next breath will be the same pressure. And this same pressure, because the resistance decreased, is going to deliver higher tidal volume. So let's do that. I'm going to improve the resistance back to normal and freeze it for you. Take a look on the pressure. It's the same pressure compared to this one. Look at the volume. More than 500. Now, the pressure is going to go down gradually. Every breath is going to be 2 to 3 centimeters of water. So this way the pressure is regulated up and or down, dependent on what's happening with the resistance or the components. So I see that we have a question. Does ATC have some impact on the level of pressure regulation? The answer is if we have ATC on, it's going to utilize less pressure support when you have pressure support. This is not spontaneous breath of mode of ventilation. It is a mandatory mode of ventilation. The volume, the target is the volume, which is 500. And now with this, it's going to be delivered with a certain pressure. if we have ATC on, it's going to take the initial rise in the pressure required to overcome the airway resistance, the ET tube resistance. So it will not have an effect on the pressure regulation after that. About the ATC on here. Okay. So now, is this clear for Grace how the pressure is regulated up or down?
Yeah. Auto
It's the
feedback.
same thing. Excellent. Same thing whether you change the resistance or the compliance. Now, how do we know that this is a change in the resistance or change in the compliance? Because the pressure is going to stay the same, but the volume is going to be less in both conditions, in both cases. So let's do that again and see how we can differentiate. So this is back to normal. I'm going to increase the resistance. And of course, this is going to be the same pressure. Take a look on the flow, on the expiratory flow. So the pressure here is going to increase gradually. And eventually we're going to get to 500 as you see here. But before I unfreeze, I want you to see that this is before resistance is increased and this is after. Look at the expiratory flow. You will see that there is a limitation to the flow. First, the peak expiratory flow is less. Then the slope is shallower. And then let's compare this to the problem with the compliance. I'm going to improve this again. And I will wait till I get back to tidal volume of 500 and then see the decreased compliance. So it is 518. Next one here is going to be with less compliance. So take a look here. What you see is, since the compliance is decreased, the lung will empty very fast. So the peak expiratory flow is increased. Look at the slope, it's sharper, and the duration is less. So by looking at the expiratory phase, you know that, well, this lung is emptying very fast. There's no limitation on the flow. Similarly, if you take a look on the inspiratory phase, you will see that we're able to get this air in shorter time. Like there's almost a plateau here, because the lung is very non-compliant. And expiratory flow in order to determine whether this is resistance problem or compliance problem. The last thing that you need to know with this mode of ventilation, let's just go back on the compliance. So the last thing that you need to know, that the circuit is open. This is specific to the dragger ventilator. The patient can breathe at any time. He can breathe during inspiration or during expiration. So let him breathe, and I'm going to give him a higher rate. So you can see how he can do that at any time. So here you can see that the patient had a breath. This is a negative pressure. You can see here that he exhaled, and let's just freeze this, or we can wait for another one. Okay. Okay, I'll freeze this one. So this is a breath by the ventilator. This is the flow. And you can see this is the volume, goes up to 500. And then during inspiration, you can see during inspiration. This is because the patient's exhalation. And then exhalation started and he exhaled all the way. This is inspiration by the patient. So the patient can breathe at any time during this. Here, you can see that there is inspiratory flow. This is inspiratory flow, inspiration, expiration too. Patient was able to breathe in expiratory time. Similarly here, the patient. And this is specific to the autoflow, which is on Drager. I think that's all what we need to know. Grace, do you have any question, Grace, about this?
No, I don't have. So as long as the volume delivered is the same, is that why it still lets the patient breathe themselves?
Well, no, the circuit is open for the patient. He can breathe at any time. So it's not related to the volume. It's just like more convenient to the patient. They just remove that so we don't get into this.
Does it still ensure that the patient gets the same minute volume?
Yes, it's of 500, no matter what. The pressure for those press is going to be regulated up and down based on the resistance and compliance. Now, with this mode of ventilation, you're going to see variability in the volume and variability in the pressure. And sometimes it's very messy, actually. It's like pressure is all over the place because if there's if the patient is hiccuping, for example, it's going to affect the pressure. And you can see that there's a variation in the volume. It is convenient for the patient if he's able to tolerate this mode. And in fact, I like to put it on all patients. It's like there's no reason why we should do volume control or pressure control. Just do volume pressure regulated volume control on all patients. But if the patient's volume is all over the place, especially in ARDS, you don't want the patient to get large tidal volume because it takes time for the regulation of the pressure. And during that time, the volume may actually exceed the target that you have placed on the ventilator. So always when you put this mode of ventilation, think of the protective lung strategy for the patients and make sure that it is actually side, Grace, if you can actually. Sumaya is asking, patient is on SIMV PRVC mode, setting 400, PEEP of 6, pressure support of 10, tidal volume 450, respiratory rate 60. He desaturated saturation 79, tachypneic. Suction was done. Minimal secretions. Not a case of COPD or asthma, of sedation. The mode shifted to SIMV, pressure control, with the same settings. And his condition improved. Why he improved on pressure control? Okay, let's try to comprehend. What she did is she changed. So initially it was PRVC, pressure regulation, but it's on SIMV. And SIMV meaning that the patient can breathe in between. So when she changed to pressure control, pressure is actually minimal actually. It's hard to, we need to look at more details in order to determine why did he deliver the volume? That's my question. With the first, was he delivering the volume of 450 with the respiratory rate of 16? If you're able to, Sumaya, if you're able to, I'll give you the mic so you can talk. So Sumaya, was he able to, with the initial settings, was he delivering the tidal volume?
Yes, doctor, he delivered the tidal volume. And while I shift him to VBC mode, also he delivered the volume. So I didn't know why this happened to the patient while I shifting to this mode.
Mm-hmm. Yeah, so when we have the settings on the ventilator in different modes, you need to see what changed between one setting, one mode and another. And if you're telling me that this patient was of course, he's getting every time 450. He's getting only the 16 at 450, and then the remaining is getting everyone with a pressure support of 10. So with the pressure support of 10, how much tidal volume was he getting with those breaths? So because he's got 16 mandatory, and then 14 or more than 14, because you said that the respiratory rate is more than 30.
Yeah,
that would be actually the only changes between the two modes, that when you change to pressure control, every single breath by the patient is going to give him 450. His minute ventilation now is increased from 450 times 16, and this is the mandatory minute ventilation SIMV. Now, if he's breathing at 30, his minute ventilation is going to be 450 times 30. Everything else on the SIMV was delivered with pressure support, and whatever that pressure support of 10 is delivering. So I can see that if he's still breathing around 30, he's getting higher minute ventilation. And that's the only explanation why he got better, is he needed the minute ventilation. So Maya, did the rate eventually go down?
On BC, yeah, it's good down.
And how low did it go?
Sorry, doctor, your voice.
Eventually, yeah, I'm sorry. Eventually, what was the rate, the respiratory rate on the on pressure control?
On pressure control, 16, same. I didn't change anything.
But was he breathing? What was he breathing higher than 16?
No, higher than 16, but
yes.
not technical. Between
so everything
16,
and that's
yeah,
everything higher than 16 is going to be delivered with 450 on pressure control. It's going to be delivered. I'm sorry, it's going to be delivered with the pressure control that you set on. What was the pressure control level?
20.
And
20, yeah.
That 20 was delivering 450. Is that correct?
More than it reached around 350, but not reach 400. Oh, the tidal volume of
it's difficult to mention without looking at the details. Yeah. So the pressure control, whatever you set on the ventilator with the pressure control, is going to deliver, guarantee that every breath is going to be delivered with that pressure control, and the volume will be dependent on that pressure that you set. The only difference between the pressure control and SIMV is that in between those 16 breaths, the patient is going to get the pressure support, not the pressure control. So next question from Rashid, what is PRVC effect? So all what you achieve with PRVC is regulation of the pressure. Instead of sudden rise in the pressure, when there's a change in the resistance of the compliance, and this may actually be not comfortable to the patient, it will be smooth increase in the pressure or smooth decrease. So it's going to be gradual increase or gradual decrease, and this is more convenient to the patient. Any other questions? Okay. So,